Welcome, my name is Rebecca Giles, and today I'll be taking you through an initial client consultation. I'll begin by introducing the client using some pre-screening tools before moving to a needs analysis for the client and follow up with an action plan. Today we use the ESSA Adult Pre-Screening Exercise tool, the QT New Client Screen, and the PARQ. Each of these fed into the needs analysis to figure out what the client's goals were, which then gave us a starting point for a future action plan. The client today is a 32-year-old female, Tony Johnson. She's 175.5 centimeters tall and weighs 60 kilos, which gives us a BMI of 19.8. Her resting blood pressure was 115/65, which is below the normal range and means she's not at risk of hypertension. At 200 total minutes, she currently exceeds the minimum activity level requirements set by ACSM. However, she does have two risk factors. She can experience dizziness due to low iron levels, and she does have a previous glute injury. The glute injury she has seen a physiotherapist for, but she's been cleared for exercise. However, the iron levels do present a current risk, and she'll have to first see a GP before commencing any further activity or exercise. Tony's reason for her appointment was to become stronger for everyday living purposes. She's currently undertaking non-structured gym sessions, which include weight machines and some cardio on the treadmill. With 80 minutes of moderate physical activity and 120 minutes of vigorous activity, the client meets the current ACSM recommendations. She has attended a physio for a glute injury, however since then she's been cleared for exercise. She's a stay-at-home mum and a full-time student. She was previously an elite level soccer player, and her current activities include the gym, active weekends with her daughter, and a fair amount of incidental walking, which accounts for the majority of her moderate level physical activity. We have separated the client's goals into three key areas: performance, health, and behaviour. For Tony's performance goals, she would like to increase her strength and the amount of lean muscle she has to support her activities of daily living. For her health goals, she would like to manage her iron levels with her diet to allow for the increased physical activity levels she'll be undertaking. Finally, for behaviour, she would like to begin a yoga program for meditative purposes. In order to achieve the client's performance goals, it's recommended that she begins a graduated strength program at the gym to improve her strength, and she should also experience some hypertrophy with this. This is not meant to take away from her current cardio levels, but instead focus the weight training that she's already undertaking. In regards to the client's health goals, there are studies that suggest that increased training can affect her iron status. Because her iron levels are already low, it's an area that will need to be monitored. The client's behavioural goal for the purpose of meditation has a slightly different focus than her exercise-driven performance and health goals. However, the positive outcomes of yoga include strength benefits, and it can help the client meet the ACSM recommendations for stretching. Also, because she requested yoga, it has the added benefit of an enhanced adherence to the program, so she's more likely to continue if she's interested and engaged. Overall, it's going to be important to regard her as a whole person and ensure that these activities are flexible for her lifestyle. For Tony's action plan, we'll begin with a strength program. It's recommended that she undergo testing to provide a baseline at the beginning of the exercise program to allow for assessment of progress. This testing would include 1 rep max test, body density, and body composition using skin folds and girth and breadth measurements. Before she attends yoga classes with a qualified practitioner, we can also perform range of motion testing to provide a baseline following the ESSA protocols. This would include the sit and reach test, a weight-bearing lunge test, and the Thomas test. A further goniometer test can also be undertaken if any areas of tightness are discovered. Finally, it's recommended that she see a nutritionist to help monitor her iron levels and to make a plan to maintain the optimal levels through her diet. It may be necessary for iron supplementation as she increases her physical activity, but the nutritionist is in a primary position to guide her in that regard. In conclusion, the client is a healthy, active female currently meeting the activity level requirements but wanting to gain strength, maintain iron levels, and begin yoga. It's recommended that she begin by visiting a GP before undertaking a gym-based strength program, taking yoga classes with a qualified practitioner, and visiting a nutritionist.